Members are please asked to take their seats and subdue their conversations. Chair recognizes Mr. Roy of Franklin.
Thank you, Mr. Speaker. Thank you for your continued support and leadership in the healthcare arena. Because of your leadership, Massachusetts continues to lead the way in increasing access to care, improving quality, and increasing efficiencies in the delivery of services. I also want to thank the Majority Leader and the gentleman from Jamaica Plain for their commitment to healthcare, their expertise in this area, and their guidance in getting us here today under difficult circumstances. For more than a decade, Massachusetts has been a leader in healthcare system transformation as we have expanded insurance access by promoting shared responsibility among individuals, employers, and government. We've adopted market-based insurance policies that promote balance between containing costs while maintaining value and comprehensive coverage. We've initiated system-wide reforms to promote integration in healthcare delivery and payment models to reduce fragmentation in healthcare by focusing on improvements, payment, delivery, and insurance. We've expanded our data collection and analysis capabilities to promote transparency, which support efforts to improve quality, patient safety, and consumer education. And we've invested in research and development to promote innovation in biotechnology, health information technology, and now digital health to bring forth new treatments and therapies that are curing sickness and improving lives. Shared responsibility, balance, integration, transparency, and innovation. This is how we in this chamber have approached healthcare in the past, and this is the approach we will take in the legislation before you now. House Bill 4617, the Honorable Peter V. Cocott Act to enhance access to high-quality, affordable, and transparent health care in the Commonwealth, is named after our dear colleague and a gentleman I had the honor of serving under as Vice Chair of the Joint Committee on Healthcare Finance. When he passed in February of this year, we made a commitment to follow the detailed outline he left us and craft a bill that reinforced the principles he espoused and provided increased access to care for the residents of this Commonwealth, improve the quality of that care, and address the costs. I'm proud to stand here today and say that we have lived up to that promise. The legislation we are considering today has been carefully crafted to consider the variety of stakeholders who have shared priorities with the legislature. And I want to thank the many members who have weighed in and contributed to the development of this bill. It is crafted from dozens of bills filed by you, and it ultimately shapes around improving the experience for patients. The bill takes significant steps at addressing some of the most pressing concerns in our healthcare system today: price variation, unnecessary cost growth, consumer engagement, and greater transparency. It harnesses technology and innovation to improve the delivery of care. More specifically, the bill includes policies that will help stabilize the finances of community hospitals and health centers to help these critical providers of care to transition to the new models of integrated value-based care. It contains new requirements for consumer engagement and greater transparency on healthcare costs and insurance plan designs. It will assist patients and employers in navigating their coverage options and shopping for care based on both quality and cost. Under the legislation, consumers will also be protected from surprise bills, and notice provisions for out-of-network billing and facility fees will be strengthened. The transparency provisions also extend to the pharmaceutical industry, mass health, and pharmacy benefit managers. The Act also advances innovation and harnesses technology by embracing telemedicine, reinforcing mobile integrated health, and expanding the mission of the Massachusetts eHealth Institute to accelerate the adoption of digital health. We recapitalized the Prevention and Wellness Trust Fund and expand its reach by dedicating a percentage of the grants to support regional projects in communities that were not able to access funds under the first program. It includes a number of provisions to expand access to healthcare providers and ensures equitable access to healthcare resources. And finally, the Act establishes some commissions and a task force to look at the financial stability of nursing homes, examine administrative costs in the healthcare system, and to look at existing special healthcare funds to evaluate them for effectiveness and efficiency. I want to take a moment to speak about some of the technological and innovative solutions offered in the bill: telemedicine, digital health, and data collection. Telemedicine is one of the fastest growing care delivery services in healthcare today. It holds great promise to transform healthcare to be more accessible to patients where they are and when they need it. Our goal with the bill is to encourage the continued growth of telemedicine. We wanted to clarify what we have in law to make sure that everyone is sticking to the same guardrails without being too prescriptive, so the field can continue to innovate. We also wanted to make sure that patients are protected and receive quality care. The bill also includes proxy credentialing to remove barriers for off-site clinicians to engage in telemedicine in hospitals and clinics. Once a provider is credentialed in one hospital, they will not have to undergo lengthy credentialing processes at every hospital where they provide telemedicine services. And one last key approach on telemedicine: we keep the focus on the patient and require the Board of Registration of Medicine to promulgate regulations on the practice standards provided through telemedicine. In the digital health arena, we know that digital health can improve primary care, reduce spending, and increase the overall efficiency for healthcare providers. Apps that can connect first responders to hospitals, data management systems, and technology developed for a healthcare transportation platform are all examples of successful results of prioritizing digital health. Massachusetts is a known leader in innovation of biotechnology and healthcare, and it is important that we also make Massachusetts a hub for digital health. This legislation seeks to strengthen our support for the growing digital health sector by expanding access to grants offered by the Massachusetts eHealth Institute and the Health Policy Commission. Investing in digital health is good for our economy, our healthcare system, and the public health in our Commonwealth. And in the data collection area, Massachusetts has a very large and thriving healthcare system with a number of governmental agencies tasked with analyzing data and recommending changes. We are fortunate to have agencies such as the Center for Health Information and Analysis and the Health Policy Commission as effective and crucial participants in the health policy making process. This bill will further utilize these existing agencies through data collection that will examine the resources to find the best solutions for challenges in healthcare. It will help us maximize the impact of our existing data collection and policy development resources. In closing, the reforms in this bill will help us deliver more sustainable methods of improving healthcare in Massachusetts. The Massachusetts approach to health reform is not about squeezing out efficiencies and cutting costs. Rather, it is transforming how we seek to pay for care to promote cost-effective, value-driven services in a way that makes the healthcare system more accessible and effective for us all. Massachusetts continues to be a leader in healthcare and public health areas, and this bill will indeed move us further along towards increased accessibility, higher quality, and more affordable healthcare for all. Thank you.